Hello, and thank you for joining me. My name is Hao. I am your occupational therapist. In this episode, I am just going to talk to you about my review on some of the podcasts that I have done over the last few months. And I was just looking at the ranking of it, and I just would like to play particular focus on at the bottom part, and the one that has the least engagement, or the one where people has least interest. And the one that has the least interest is among them is understanding the tools of the trade. Occupational therapists understanding of the tools of the trade and the tools of function. If you look at it, what could be the implication of this? It could mean a few things. It could well mean that the occupational therapy in general, or occupational therapy profession in general, and a lot of occupational therapists are aware of the tools of their trade, that they don't bother listening to it. That's one. The other one is maybe it's very boring at the very beginning of the talk, so that it doesn't allow people to move on to listen. That's the second one. And the other one is that people are just not bothered about it as well. So those are the three things that are the potential. So I just hope that, this one is saying, yes, it's understandable, the tools of the trade is there, but you want really for people to be confident and be familiar with it, the tools of the trade of occupational therapy. So if I'd like to remind you what they are, they'd be the use of lots of things, the use of self, the way you conduct yourself with the patient, the attitude that you present to patients, the behavior that you are sharing to the patients, the way how funny you are, how receptive you are, how much of a listener you are. Sometimes you don't want to do things, you don't want to be funny, but for somebody who is a little bit low, then you may have to conduct your way in such a way that you are more of an upbeat kind of person, so that you need to project that energy and share that energy to the person that you are talking with, or person you are working with, so that they can be infected by that energy. And that's the use of yourself. Another way on how to use self is through your assessments and your observation. Your observation through visual observations, auditory observations, and manual and tactile observations are some of the tools that you use in your practice, particularly on interventions, particularly on not goal and discharge planning, intervention, direct intervention, when you're performing restorative interventions. There is no, at the moment, I don't think AI can catch up with that, because AI will need to sense it, whereas as an occupational therapist, you are sensing all of those things, and when you do, you can then make some form of assessment and analysis. So that's one in terms of the use of self. When it comes to the use of activities or therapeutic activities, it is something that we can be using as well as an occupational therapist. And remember that the use of activities is not just the ADL abilities. You can use arts and crafts and enabling activities, anything that could engage a person and stimulate the actual performance components. So if you wanted to improve the upper limb, then you can use lots of other things. You can do cutting, you can do writing, you can do coloring, you can do some manipulation, you can play with Lego, you can play with nuts and bolts, anything, wires, pliers, you can use cutlery, anything that you can really use. So the use of activities and therapeutic activities. So that's one. And it is particularly useful when on the stage of enabling therapy. So when you're doing enabling therapies, they're not direct ADL retraining yet, but what they are like little parts and little components that you can be using to build up that skill when you actually have to do that ADL retraining. Use of occupation, once again, are some of the activities that is interest related. So some of the activities where it depends on the person's motivation, or some of the areas where they are, the things that they like. So you can use that, and you can only use these things if you know what they are. So it will fall down on your ability to look after their interests. It will fall on your ability to really know the person, rather than those situations being handed over to you by other members of the multidisciplinary team. The use of environment is, again, you can change the environment. You can make the environment stimulating. If you're in a clinical area, and if you're in a clinical room where it's all white, then it is really, there's not a lot of things to do in there, isn't it? Apart from watch the telly or sleep. So those are the only things that you need to do. So you can stimulate that by changing, adding colors into it. Use the arts and crafts that you're doing with your patients, and then start decorating it. Make it personal. Try to make it personal so that it will facilitate recovery. So that is the use of environment to enable the person. That is to enable recovery if you are working in a hospital environment. If you are working in the community, then yes, you can modify the environment and to enable a person to engage and to participate. If they are a wheelchair user, then obviously you need to allow ramps. You need to enable accessibility. So that is the use of environment. If the even the sound that's coming in, the theme, the tidiness of the room, the smell of the room, so you can use these things. That's why we can be involved in delivering all the other techniques, like use of aromatherapy, for example. So you can do that, use of massage oils and things like that. So you can use that. This would be on the use of environment. Use of some of the developmental and neurodevelopmental techniques and treatment. This would be a staple thing, particularly if you are doing and delivering some interventions relating to neurorehabilitation. So the techniques that you do, the way you handle the arm, the way you facilitate, some of the inhibitory and facilitatory techniques that were devised and conceptualized by Rude and Bobath, Boss and Knott, PNF, Carr and Shepherds of motor learning. These are some of the things that you can do. Use of orthotic devices, you can use that. So splints, something that you can use to enable participation, particularly if you are making and if you are there working in prosthesis. So if you're specializing on amputation, then that is something that you can use. Orthosis can be utilized to prevent deterioration of the soft tissues of the upper limb, maintain the length, using a biomechanical technique onto those things. So that is, again, the use of orthotic devices. And any other tools. Teaching and learning is one of the techniques that you can use as an occupational therapist. Obviously, every time you would educate the person and their family, you would employ and you would apply the teaching and learning strategies and techniques. And use of what else? Use of groups. Yes, you can stimulate change. You can use change participation. You can motivate a person. You can change, motivate, increase participation of a person if you gather them or group them together. So again, this is more of a specific intervention for mental health. The talking therapies, for example, arts and crafts group, communication group. You can have reality orientation group. You can have thematic group, okay, which means together you are identifying problems. Recently, we have been working on gathering few people together who are or who is in the lines or waiting to have their heart operation, and there's a group of people sitting down together. And at first, you wouldn't think that there is a problem there because they're all independent and they're all young. But when you sit them together, and all of a sudden, it becomes more of a sharing. So there's a psychological sharing, there is experience sharing. They share their fear and what their concerns are, and it is very reassuring for them. So it is a very, very powerful tool as well. Some of the tools of the trade is activity analysis once again. So activity analysis is you look at the activities and or the task demand of the person, and then you want to see whether this task is suitable to be performed by the patient. So that's one way of doing that. That's an activity analysis when you are thinking of the demands of the activity. But also activity analysis is also analyzing the person's abilities. So when you analyze the person's abilities, and say, for example, I get the person to stand up, and just by standing alone, and I can observe the person maintaining their balance, if they're able to do that, then I'd go and ask them to move their hands away, reach forward, move their arms across their body, reach behind them, and try and touch their knees, for example. And if they're able to do that, then I can analyze that movement and that person's ability, and I know that that would be a skill that a person can do when they're brushing their teeth. So it should be okay because their balance is good enough at that standing situation alone. So I can see that they have that skill that can be transferred. And I can only do that because I've done a very quick activity analysis. And over a period of time, this technique and this strategy and this skill builds up, to a point that a clinician does not have to think about doing it anymore because it is a process that's happening very quickly in the head of the clinician. So that is activity analysis. I did say use of occupation, didn't I? Or some of the interest-related activities, and we can use that to motivate the person. And there you go, guys. So that's just a reminder of some of the tools of practice of occupational therapy. I just thought I'd like to have a discussion about that because I am worried that, on the first episodes, it does not appear like a lot of occupational therapists are aware or are interested in that aspect, in that particular topic. Now, the implication of this is that why is it important for an occupational therapist to be mindful of this? It is very, very useful if you are doing your clinical reasoning. It is very useful if you have, or when you start to have students of your own, where you are passing on the skills of an occupational therapist to a learning student who wanted to become an occupational therapist in the future. So what happens is, if you're not aware of this and you have trained the student and the student did not come across this information, what will happen is the student will grow to become a clinician not knowing the tools of their trade. So if we needed to pass on our skills, our profession, and we wanted to have sustainability, and we wanted to grow the profession or maintain the strength of the profession, these are some of the very basic information and very basic knowledge base that we need to have. So these are all foundation skills, right? I hope you enjoyed this talk today. Until next time.